Hey, Ron, I saw this on the news last night. We were talking about aspirin just a few weeks ago, and you were telling me you went back to taking a small dose of baby aspirin every day. And I said, well, you told me once that wasn't a good thing to do. And you said, yeah, but now that I'm older, you're 70 now, and I'm approaching 70, the month after next. So I saw this on the news, and you may have already gotten this news that I saw last night on TV. I have it pointed on my TV right now because I recorded it. It's in the freeze frame, but I'm going to start it right now. And here we go. Listen.
Guideline of aspirin affecting millions after years of recommending older adults take a daily low-dose aspirin to help prevent a first heart attack, stroke, and colorectal cancer. Tonight, an influential health advisory group is now saying the risk of bleeding may outweigh the benefits from that aspirin. So who should take it and who shouldn't? ABC's Ariel Resha breaking this down for us.
Tonight, those new draft guidelines from a panel of experts recommending doctors stop prescribing daily aspirin for people over 60 to lower the risk of having a first heart attack and stroke.
They've shown that the risk of bleeding or gastrointestinal side effects outweigh the benefit of taking aspirin therapy at the current time.
That updated guidance also reversing the recommendation to take baby aspirin to reduce the risk of colorectal cancer. For decades, aspirin has been prescribed as a blood thinner to reduce the chance of blood clots. But aspirin will still be recommended for patients who have already had a cardiac event.
So Ariel back with us tonight, and Ariel, let's drill down on this guidance one more time because I know it can be whiplash for people at home, the changing guidance. For so long we have heard about taking a daily aspirin to prevent a heart attack or stroke. But now they're saying if you're over 60 and you haven't had a cardiac event, even if you're at increased high risk, they say don't do it.
That's right, David. Even if you are over 60 and at high risk, experts say do not take that daily dose of aspirin unless you have had a cardiac event. Of course, no one should stop taking their aspirin before first consulting their doctor. David?
Of course, that's the best advice. Comes from your own doctor. Thank you, Ariel.
Well, there you go, Ron. Neither of us had a heart attack. The news is still on, but I had to put the volume off. They said, hey, if you're in your 60s, you haven't had a heart attack, you should not be taking that baby aspirin every day because the risk of blood clotting is greater than what you would expect the benefit to be to stop a heart attack. But if you haven't had one, it wouldn't matter much according to the studies. You heard it. All right, so I just wanted to feed you that because we were just talking about this a couple of weeks ago when you told me you were going back to taking it now. So I've been taking it ever since for the last couple of days. Every day, every morning, I'm popping a baby aspirin thinking about you. But now I'm going to think, oh, now I got you some good news for you. Or if it's good news, anyway. All right, Ronald, that's it. The TV's running in the background here. I'm just chilling out in bed. All right, have a great night. I'll send this to you on a link. I'll download it on YouTube. This way you can get it on your phone on a link. And I'll message it to you. Okay? Have a great day, Ron. Okay, bye-bye.